Evening, everyone. Welcome to my IVF Answers and the European Fertility Society. We are back, and I'm very happy to be back with Dr. Esther Marban. As you can see her right here. So we are connecting to Madrid, to Clinica Tambre. Hello, Dr. Marban. It's great to have you back. This is an interesting topic, and I'm so happy to see you. And of course, I'm really looking forward to see what you have prepared on our topic, and we will talk about egg donation. And how are you today?
Well, as usual, I'm really glad of being here today, this evening, and I have the chance of talking to you and also, giving some important information to our potential patients. So, as usual, I'm happy of being here and also open to all the potential questions we have.
Excellent. Thank you so much for joining us tonight. This is definitely a special time for the European Fertility Society. We have been to ESHRE. We have been able to organize fertility care awards, and the awards went really great. And it happened actually on Monday this week, so just 2 days ago. So we are really excited. Of course, Clinica Tambre was one of the actual participants. So it was lovely to meet your entire team as well. I mean, some part of the team, of course, it's a huge team, but it was nice to finally see you. And I'm glad that you are here with us. Of course, that's the reason we needed to reschedule. As you know, we usually do the webinars on Tuesdays, but that's not a problem. I'm glad that you are all here today, and I'm sure it's going to be an interesting session. Right before we finish, let me just mention that it's all recorded. You will have a chance to rewatch this. And of course, if you have any questions, don't forget to type those in the chat section. Dr. Marwan will surely answer them for you right after her presentation. And as you know, today we will talk about egg donation treatment and when to consider it. So I think it's a very interesting topic that we have tonight. I hope you will find it useful, informative. I am sure of it, to be honest. And of course, if you have anything that you would like to ask, you know what to do. And now let's get starting with the topic and our presentation. Dr. Marban, ready?
Right.
Thank you so much then. Let's
Thank
go.
you. Thank you. Okay, so let's start with the topic that we have prepared today. As Carolyn has mentioned, we are talking about egg donation treatment. Is it for me, and when should I start to consider it? So here you can see a summary of what will we cover. So we'll try to go step by step with all the different topics that we would like to discuss today. So first of all, let's define what egg donation. According to the ESRE, which stands for the European Society of Human Reproduction and Embryology, in 2017 they defined egg donation like a fertility treatment for women unable to produce their own eggs or at a high risk of transmitting a genetic disease. The donated eggs are fertilized with partner or donor sperm as in a conventional IVF treatment cycle, and one or even two um, embryos will be transferred for pregnancy. So, what are the main indications to think about egg donation? The most important one and the most common one we normally find the consultation is the advanced maternal age. That advanced maternal age is defined as getting pregnant when a patient is 35 years old or older. Apart from that, we know that age also may have an important impact in the egg quality and the ovarian reserve. We know that ovarian reserve and the egg quality may decrease as aging increases. Apart from that, it's also important to consider that the chances of carrying a baby with chromosomal disorders such as Down syndrome increase as the patient gets older. So we should also consider that potential fetal risks as miscarriage, stillbirth, and abnormal growth that are also related to age, and the ones also related in terms of the maternal risks, such as high blood pressure, diabetes, and premature birth. Those risks are even higher if if a twin pregnancy happens. In this slide, you can see the how important age in terms of the ovarian reserve, the antral follicle count, and the AMH level. So in that way, we can see how the ovarian reserve starts decreasing as the patient gets older. So there's like a important moment which is around 35 years old, which is the moment when we see that the ovarian reserve start decreasing quite a lot. The same happens with the antral follicle count that we can count with the ultrasound, and exactly the same happens with the anti-mullerian hormone result. So in that way, that we see like in the consultation that many patients, of course, when they are like getting older, we see that those important things happen, and it could be an issue for us. So as I mentioned, age could be the main reason why a patient has to undergo egg donation. Apart from age, as we mentioned, we're also mentioning before that the potential number of non-healthy embryos that women may produce in certain moments of their lives could be also increased, and it's also related to age. So in this slide, you can see how the potential rate of non-healthy embryos, which means aneuploidy or also aneuploid embryos, start increasing as also the age increases. So in that way, that's also something that we should consider and explain to our patients. So apart from the potential equality, also the potential chromosome problems in the embryo should be also considered to decide the best treatment for each patient. Apart from that important issue with this age, which is one of the most common ones, as we were mentioning before, it's also important to consider other indications that can also be quite common to be found. First of all, the premature ovarian failure or menopause. There are patients, of course, they are like older than 40 years old. Sometimes we see patients that they are already on menopause, but also young patients because of different medical factors. A patient with a premature ovarian failure that their ovaries don't work anymore, it could be the ideal option, and sometimes the only option to get pregnant is undergoing egg donation. So in that way, when a patient is not menstruating anymore, or when we see that the anti-mullerian hormone is really low and the FSH, which is another hormone produced in the brain, also is really high, and as I mentioned, it's not menstruating anymore, we should consider egg donation as the first line treatment for those patients. Apart from that, another big group of patients is the ones that had previous IVF cycles that weren't successful. In that way, when we call that a failure of IVF, doing egg donation could be like the best option in those patients. As I mentioned, when the IVF treatment fails, sometimes there are no more options with that patient's eggs, and we need to, or at least we should, consider a different option as egg donation. If we are talking about, or we are thinking that the main reason for that failure could be the egg quality and also the embryo quality, doing egg donation could give our patients a really good chance of pregnancy. As I was mentioning before, the same happens with the low quality and low quantity of eggs. In the end, everything is like well related to age. So in the end, if we are having a patient in a certain age, also with low egg quality and a small amount of potential eggs to be fertilized, in the end, what we know is that after maybe several failed IVF attempts, we should consider at least a different treatment such egg donation. So of course, this patient is different, but we are talking, of course, in general, and everything will depend on other factors. But generally speaking, I would say that when we have failed several, times with the IVF, and of course, considering the how the cycles went, also considering the quality of the eggs and the quantity, we should consider other options. A different indication would be some hereditary problems that cannot be diagnosed by the conventional techniques. And sometimes, as I mentioned, if a patient is carrying a specific mutation, it has to be tested in the embryo, but in the end, we don't have like a good number of of potential embryos to be tested by that for that hereditary diseases. In the end, it would be not like a good option to have a healthy baby. So because of that, if everything is like almost like related, as I was mentioning before, so if we have like some hereditary problems that should be discarded in the embryo, but we don't have a good number of embryos, also good quality embryos that can be tested, in the end, we know that the one of the best options for that patient is, of course, doing egg donation. That first we will avoid that hereditary problem first, and then we'll also avoid other potential problems in the eggs that can also be playing a role. And finally, the last indication that we normally see at the consultation is like some medical conditions, such as patients that have suffered a cancer and they had to use chemotherapy that can be toxic for the ovaries. And in certain patients that ovaries do not work anymore, those patients start being on menopause, and the only way for getting pregnant is doing egg donation. And finally, some kind of endometriosis. It's also related to that specific illness to sometimes low ovarian reserve and also low quality of the eggs. And in certain patients, after several IVF treatments, if they are not successful, we also start considering egg donation. So here you can see in a quite an easy slide how egg donation works step by step. So first of all, we need to select the best donor. So we'll discuss about that in a while. So the idea is that we need to select the most suitable donor for each patient. So that donor will undergo an ovarian stimulation similar to the one that we normally do for the conventional IVF. So we'll retrieve the eggs that will be fertilized with the patient, with the partner's sperm sample, or with a sperm donor sample, and we will wait for 5 days to see how the embryos develop. Generally speaking, of course, everything will depend on the kind of treatment the patient wants to undergo, but many patients prefer to freeze the embryos in advance with the idea of doing first the donor's part and then not having like the chance of being synchronized with the egg donor's menstruation. So in the end, we are flexible in that way. Some patients prefer to do the treatment at the same time as the egg donor. If it's the case, we will synchronize the menstruation of the patient with the egg donor's ones, and we'll try to do the treatment at the same time. So doing it, the first embryo transfer will be done with a fresh embryo. However, it's not the only option. As I was saying before, it's also possible to freeze the embryos in advance so that the patient can do the preparation of the uterus, which is needed after having the embryos ready. So in both cases, things are quite similar, but it's true that sometimes, at least in our experience, doing the treatment with frozen embryos can be like less stressful for our patients. And of course, we are, as I mentioned, we are flexible in that way. And if the patient prefers to do the embryo transfer with a fresh embryo, of course we can also do it. So as I was saying, the first step is selecting the donor. Then the donor will be undergoing an ovarian stimulation, and the patient will be preparing her uterus with the idea of having that endometrium and that uterus in the best conditions possible for the embryo transfer. So the embryo transfer will always take place with a day 5 embryo. Of course, the embryos can also be tested and can also be chromosomically tested to transfer just healthy embryos. So in that way, we were mentioned that it will be also one option to consider. But as I mentioned, normally we always do the embryo transfer with a day 5 embryo with the idea of increasing as much as possible the implantation rate. After having done the embryo transfer, even with a fresh or a frozen embryo, the patient has to wait for around 11 days to do the pregnancy test and know if she's pregnant. So the treatment that the patient is doing is quite easy to follow, so nothing to do with a normal IVF stimulation that the injections and also the scans that have to be done are quite, sometimes are difficult to deal with, but with the treatment we normally prescribe to our patients, everything is much easier. So we were saying before that the first step is selecting the best donor for each patient. So how we do select the donors normally. So first of all, the criteria for our donors is like age. They should be younger than 32 years old. So the minimum height it's 1.55 meters, and the maximum body mass index is 30. So first of all, they have to have a consultation, a first visit with our nursing team. They will do a complete analysis. We will know their medical conditions, familiar background, and everything like important in that way. And of course, they will also explain the process to that patient, to that donor. Apart from that, we always, all donors have to have an interview with our psychologist in order to exclude potential emotional problems in that way and mental problems. And she will also perform some psychological tests to be sure that everything is also fine in that way. After having done that consultation, they will be performing some medical tests. So the first one are the most general ones, including a complete blood cell count, a blood type, and also like infectious disease screening. Apart from that, we always perform some gynecological tests with ultrasound, pap smear. We always do an ultrafollicle count, and we do also a vaginal culture to exclude potential infections such as chlamydia, gonococcal, and so. And then finally, we do what we call the genetic test. In Spain, it's mandatory by law to perform the karyotype, which is a test to check the chromosomes. And then we always do a basic examination regarding potential recessive mutations. The most common ones could be cystic fibrosis, X-Fragile syndrome, also muscular atrophia. So those diseases will be excluded. But apart from that, it could be also, and we will mention that it's also possible to do what we call the genetic matching. So all donors have been previously tested for the most common genetic mutations, but it's also possible to do a wider examination called genetic matching that it would include more than 300 mutation 300 diseases with more than 1400 mutations to be tested. So this test is completely optional, it's not mandatory according to the law in Spain. So in that way, many patients prefer to undergo that test anyway to be like more relaxed in terms of the genetics before starting the procedure. But as I mentioned, it's not mandatory, it's something completely optional. So we were talking about how we select donors. So first of all, after having selected and after knowing that that potential donor is like in good conditions to donate, we always get focused on how to select a donor. So we always first the first step to select a donor is taking into consideration the physical characteristics of the patient, also the blood type, and then after having done the first selection, we use a special and a quite different computer program called Phenomat. That Phenomat will do a facial biometry and will know the distance between the eyes of the patient, the kind of nose the patient has, with the idea of doing our best in finding the most suitable donor for each patient. Apart from that, we also need to consider some immunological issues. Of course, it normally could be like important to select a donor in that way for a certain group of patients, for instance, with previous failed IVF cycles, also with previous miscarriages. So in that way, when we suspect, or of course, when our immunologist recommends selecting the donor also in terms of the immune system, we also do it. So apart from selecting the donor, what more we can offer? As I was explaining before, after having done the first selection, it's also possible, and we always do it, to use a different technology to select the most suitable donor for each patient. So apart from knowing the most general feature of the patient, I mean blood type, also skin color, hair color, apart from that, it's also possible to use that technology that will do a facial biometry to know the most suitable donor for each patient. In the end, we are trying to maximize the options of finding the highest resemblance with the donor. And the idea is using that technology to with all patients. So what we normally do is after having selected a certain number of potential donors, we use that technology to try to find out which is the donor that also matches better with best with the patient. As we were also explaining before, another option to try to minimize the risk of having a baby affected by that genetic disease is doing the genetic matching. As we were mentioning, all donors have been previously tested for the most common genetic disease. And then apart from doing like the basic examination, it's also possible to do that recessive mutation test with the idea of reducing that potential risk. The risk is quite low. It's important to tell our patients that the risk they are facing is not high, but it's true that it's not zero. Even though we are doing even that genetic matching, there is a very small risk that they are always, well, it's impossible not to take that risk. But in the end, it's true that if we are doing that genetic matching, the risk that the patients will be facing is much lower. So in the end, what we do is we do with a blood sample of the partner. We take that sample. It's also possible to do with saliva sample. So, but we normally prefer doing it with a blood sample. So after having the results from the patient, we put those results in common with the egg donors ones. So if we find out that there is any kind of incompatibility between the patient and the egg donor, we will change the donor and try with a different one. The idea is reducing that potential risk as much as possible. As I mentioned, the risk won't be zero at any moment, but at least it will be much lower than the initial risk the patients have. We were saying, when I was explaining the different steps regarding egg donation, I was saying that, okay, well, normally, and of course, generally speaking, when the patient wants to undergo like a normal treatment, it's possible to transfer the embryo directly on day 5. However, it's also possible to do the pre-implantational genetic screening, in which we are doing a small biopsy in the sternal part of the embryo with the idea of taking some cells to check those embryos. So the idea is selecting the chromosomally abnormal embryos. That is increasing the implantation rate as much as possible, because we know that it's true that we are talking about young donors, as we were saying before, but we never know if the embryo is like completely healthy unless we do that technique. In that technique, we are trying to reduce the potential risk of miscarriage, and at the same time, we are increasing the chance of ongoing pregnancy. What we know is that when we transfer an embryo that has not been tested yet, if the embryo is healthy, it has quite a good chances of implanting. However, if the embryo is not healthy, it's likely that the embryo directly won't implant, or it's possible that the embryo implants and then the patient may have a miscarriage. So if we want to reduce that potential risk of having a miscarriage afterwards, it would be one option. And what is also known is that if we test the embryos, it's possible to reduce the duration of the treatment and the number of cycles that we need to get to achieve a healthy pregnancy. As I mentioned, that test is not mandatory to all patients. Of course, we are talking about non a very severe male factor. If we have like a patient with an important alteration in the sperm, it could be also something that is also affecting the embryo. So if we want to decrease the potential risk to the embryo, it could be also one option. When we are talking about egg donation, it's true that we are talking about young donors, and the chances of having good quality and also healthy embryos are high. Even though we have those good results, many patients prefer to increase their chances even more, and they prefer directly to undergo that PGTA to try to reduce that potential risk of having, future miscarriages, and also trying to increase their chances as much as possible. We're also talking before about how age is important in terms of the egg quality, the egg quantity, and also the potential risks of the embryos, but it's also important to consider age as a factor for the results and the outcomes from the pregnancy. So we are talking about a really high potential rate of embryos in terms of implantation. So the embryos we are transferring, as they come from young donors with a quite a good range of age. Apart from that, many donors are fertile. Apart from that, it's also important to consider that we are talking about patients that will get pregnant. Of course, in our experience and in our clinic, it's quite normal that patients that undergo egg donation are in their 40s. If that's the case, we always recommend transferring one embryo with the idea of maximizing the implantation rate, but trying to minimize the potential risks of a twin pregnancy. As I was mentioning before, we are always transferring embryos on day 5. So those embryos have initially higher implantation rate, but apart from that, we are talking about egg donation. So in the end, the quality of those eggs is much higher, and because of that, we should consider to transfer just one embryo in almost all cases, and it's what we normally do. So here you can see the our success rate. In the first attempt, it would be around like 68%. And then you can see that we have something called cumulative pregnancy rate. So it means that if the patient has, for instance, 3 embryos total after the egg donation program, and well, the chance of getting pregnant in the first one would be quite high. If not, she can also get pregnant in the second or third attempt. In the end, the cumulative pregnancy rate means that in the end, the pregnancy rate will start increasing according to, well, depending on how many transfers we do. So that's the reason why in many occasions, I would say like almost all patients have more than one embryo, than one potential embryo to be transferred. So in the end, if they don't get pregnant in the first one, they have another chance with a different embryo in the second embryo transfer, and so. And then here you can see in the second picture how the pregnancy rate with egg donation is almost the same, and it doesn't matter how young or old the patient is. However, the pregnancy rate with the with IVF using the patient's, well, the women's own eggs start decreasing quite a lot when we are talking about patients over 35 years old. So the main reason is, as I mentioned before, is that we are using young eggs, also healthy eggs. So that's because we are using we are talking about egg donors, and because of that, the implantation and the pregnancy rate with those kind of patients is almost the same, and it doesn't matter how age is affected at that moment, which is also important to consider that it's not the same getting pregnant when we are 41 years old than when we are 49 years old. In the end, the pregnancy rate will be the same or almost the same, but the outcomes in those kind of pregnancy would be different. So the risk the patient is facing when she is like over 45 years old could be higher. That's the reason why single embryo transfer is always recommended, and of course the earliest the best, because apart from having the results in terms of the implantation rate, is also important to know what happens with those pregnancies. So as a conclusion, as we were explaining before, egg donation may be the solution for many patients after previous failed IVF attempts due to age, low ovarian reserve, and low egg quality. An exhaustive donor selection and latest technology should be applied to all patients, and due to the high pregnancy rate, selective embryo transfer should be highly recommended almost to all patients. And thank you so much for your attention.
Brilliant, as always. Thank you so much, Dr. Morban, for your presentation and explaining everything as always. And of course, we will go for all the questions right now. And there are some questions ready, but if you haven't asked anything yet, of course, and if you have any questions, go ahead, type those in so that Dr. Marban can help you with those. There are some short questions, there are some longer questions, and let's have a look at the first one here. What does it stand for, FSH?
The FSH is the follicle stimulating hormone that is produced in the brain, and it helps the ovaries to start producing also estradiol, and is one of the hormones that we checked not so frequently right now, but quite in the past before we knew about the anti-Mullerian hormones. So the FSH starts increasing as the number of potential follicles start decreasing. So in the end, it's like the brain knows that there is something going on in the ovaries, and they start like sending like signals saying, okay, you need to produce more eggs. So that's the reason why the FSH increases, but the problem is in the ovaries that they don't have more follicles to be stimulated. So in the end, the FSH increases, but it doesn't work.
Okay, thank you, Marie, for your first question, and thank you for explaining. Hope that helped. I do believe so. And Rachel has another question. So when would you recommend getting a fish sperm test done?
Well, everything will depend on the case. I mean, if we are talking about maybe an first, we have a patient with certain alterations in the karyotype, they should be tested with a FIS to know if it has any kind of problem in the sperms. Apart from that, in certain cases of male factors, when we are not sure if it could be also be an issue for that patient. Of course, we have a severe male factor, it would be one option, but everything will depend on the at least the last decision from the patients in terms of checking the embryos. I mean, if the patient is undergoing the patient is undergoing like the pre-implantation or genetic screening, doing the fees, at least in our opinion, won't add many benefits, because in the end we are going to check the embryos anyway, and if the fees is doing fine, if we are checking the embryos anyway, it won't add any benefit. If the fees is not so good and we are checking the embryos anyway, we'll see the result. So in the end, if the patient is undergoing a PUTA, we don't recommend, of course, normally doing that phase in the sperms, because we think that it won't add much important information.
Okay, thank you again for your question, Rachel. Let's have a look. Okay, next question is up. Perhaps, yeah, if you can clarify this. So, would I be considered a biological mother with egg donation? The RD egg donor, is the egg donor considered the genetic mother?
Of course, I mean, when a patient gets pregnant after an egg donation program, the biological mother of that child is the patient. I mean, the egg donor has just donated their eggs and has no relationship with the embryo. Sorry, with the baby. At least in Spain, donation is always anonymous, so the donors actually don't know, if the eggs they donated, well, were used, and also if they achieve any pregnancy. So actually in Spain, donation is always anonymous, and in that way there's quite a long distance between the patient and the egg donor. And as I mentioned, the patient is going to get pregnant and she will be the biological mother of that kid.
Okay, thank you for the clarification to this question. Next one is a short one. So, does endometriosis affect egg quality?
Well, it depends on the patient, but endometriosis normally is known that may affect the egg quantity and also the egg quality. In the end, what means that endometriosis is like that some kind of tissue that shouldn't be in the ovaries may affect the ovaries. That tissue is supposed to come from the endometrium, and because of that, the normal follicles can be occupied for that tissue, and in the end it may also affect the quality. So in the end, of course, it depends on patients. Of course, we can't say that all patients would be exactly the same, but endometriosis is quite well related to pain and also to infertility. And the way it affects fertility is reducing potentially the number of follicles and also reducing the quality of the eggs.
Okay, thank you for yet another question. How about black donors? Are they available at Clinica Tambre?
Well, we have like African donors, so in that way, it's not an issue for us. Yeah, we have African donors.
Excellent. Thank you so much for the clarification again. And so, if you wish to have some more information, as always, you can get in touch with Clinica Tambre's team. I'm sure they'll be happy to give you some more details as well. And what is the success rate in terms of live birth rate? Yeah, when it comes to egg donation as
Well,
well.
that question is quite difficult to answer, because it depends, in certain, I would say, it depends on the patient. I mean, so of course, generally speaking, I would say that approximately the life rate could be like around 50%. But of course, I'm talking in general. Of course, it depends on age, the medical background of the patient, and so I'm just talking, of course, in general. So each case has to be like, studied, step by step, and it's difficult just to say a number, and it would be, like that. But I would say like around 50%.
Okay, again, thank you for yet another question. So, why does the pregnancy rate increase with cumulative transfers?
Well, it's supposed that in the first round you are transferring one embryo, and if it doesn't work, it's like the body is like more like ready for pregnancy. So in the end, if the first one is not working, the second one may have like an increased rate. Of course, as I mentioned, we are talking about general rates, but it's true that as we do like more embryo transfer, that a potential cumulative rate can start increasing.
All right. Again, thank you so much for yet another question. Do you offer any guarantee programs at
Mhm.
Clinica Tambre, and which
Absolutely.
ones?
Absolutely. We have a
Right.
program of a guarantee program,
Yep.
in which, depending on the program the patient choose, of course, all programs are like linked to having, like, let's say, a more or less normal sperm
Of course.
result. Of course, it has not to be like perfect, but not very altered. So if there is like a very complex male factor, sometimes that program cannot give the guarantees to the patient. But in the end, we are also offering the guarantee of eggs, maybe not the guarantee of embryos, but I would say that around 95% of patients have the guarantee of embryos. And depending on the program they choose, it's possible to choose between 1 to 5 embryos. And also it's possible to, as I mentioned before, to do also the pre-implantation genetic screen of the embryos. And in that program, we always guarantee at least one healthy embryo to transfer.
Okay. Thank you again. The next question, you already answered this, yes, but I think it's important to repeat that. Yes. What access do children born of egg donation have to contact the donor or to have information about their family medical
Hmm.
history?
Yeah, as I mentioned before, egg donation is completely anonymous in Spain. So it means that the patient or even the child can't have any um, information from the donor or any contact with her. At least the law is like that. At this moment, we don't know if it may change at some point, but at this moment, it has been always that way.
Sure.
It's completely anonymous. And apart from that, it's not possible to have like any kind of information regarding the donor. Of course, if the child has any problem in terms of health and so on, and of course the parents need us to get in contact with the egg donor, it could be possible to ask maybe a certain medical question and so, but of course it won't be like a direct contact between the patient and the donor.
Okay, again, this is important to remember. Thank you so much once again for explaining this. And let's, yeah, and there's a thank you, of course, from Yvette right here.
Most welcome.
Sure. And let's see, there are some more questions coming up. And as always, if you have more, go ahead, type those in. And how necessary is PGT for donor egg and husband sperm, teratospermia? Do you recommend PET, right? Testing, I'm not sure here, in donor cycles.
Well, regarding the first question, everything will depend on the medical history of the patient. I mean, if it's the first egg donation round, if there is just aterospermia, and if the other parameters of the sperm are doing good enough, we have also checked the DNA fragmentation test and it's not excessively high. Of course, the PT would be something completely optional. We have the experience that many patients, when they decide to undergo egg donation, and especially the ones that have undergone previous IVF cycles also with PGTA, and they could see the results they had. In that way, many patients prefer to directly do like the PGTA to the embryos, even though we are using also donor eggs. But as I mentioned, it's not mandatory. So everything will depend on how many cycles that patient has undergone, if the sperm is doing good enough or not.
Thank you, Diana, for your question. And let's take a look. And sorry, just give me a second. I'm just following. Yes. Okay, good. Yeah. What is the best natural way to prepare your body for implantation at the age of 46, especially being active acrobat dancer?
Well, I would say that apart from having a healthy life, apart from that, which is like the basic thing we always say, of course, everything will depend on the chances of having like regular periods of not or not. I mean, if the patient, for instance, if Sylvia, who is around 46 years old, if she's having regular periods, it's also possible to do the preparation of the uterus in a natural cycle, which means that we don't need to use estradiol as a hormone to get the endometrium ready. However, if the patient is not having like regular periods, or if the patient wants to plan the embryo transfer much easier, it would be an option using estradiol, which is not mandatory, as I mentioned. It's just an option for patients that do not have like regular periods or want to plan the embryo transfer. But in the end, the results are exactly the same. So if the patient wants to like to determine the most natural way possible, we can try to do a natural cycle with no estradiol, just with a follicular monitor to see how the follicles grow and to check ovulation to do the treatment in the most natural conditions possible.
Okay. Again, as always, thank you so much for yet another answer. And let's have a look. Some more questions. Here's Diana again. How necessary is the HLA-C care testing? There is a reason to recommend this testing. Is there a reason?
Well, everything will depend on the background of the patient. I mean, if it's the first cycle, if we don't suspect that there could be any kind of immunological issues, we don't normally check it directly. However, if we are talking a patient that has transferred embryos before, maybe also that were checked with the pre-implantation genetic screening, and they were healthy embryos, and they are also maybe having any other immunological disorders, it could be an option before undergoing egg donation. To next cycle we need to check the embryo to select the embryo according to that. But as I mentioned, everything will depend on the previous background of the patient.
Okay. Again, thank you so much. There are some follow-ups from our previous patients. Let's get to
Mhm.
those. Rachel would like to follow up on this. So, what is the maximum age you would treat a woman using donor eggs and the sperm testing were okay?
Well, in our clinic the maximum would be 50 years old.
Mhm. Okay, sure. And here, regarding the fish question, would you think it adds any value after failed IVF attempts and natural miscarriages and deployed embryos before moving to donor eggs?
Well, it also depends on the age of the patient, right? And thinking that the sperm quality is fine, maybe I would suggest doing the DNA fragmentation test much more than doing the fish, right? Because the chance of having, parents with the fish, and in the end, sometimes the results are not so reliable. So in that way, we prefer doing the DNA fragmentation test. That will give us like more information also in the way of selecting maybe the sperm in a different way, more than doing the fees. So the fees, we normally recommend it in like very specific cases, and of course, in like a certain kind of patient, but not to all patients. However, the DNA fragmentation test, I think that can give us like much more accurate information about the sperm quality and how to select the sperms if it's needed.
Excellent. Thank you so much indeed. And the next follow up is from Diana. So, does the testing really actually reduce the chance of live birth on donor cycle regarding PGT? Does the PGT testing really actually reduce the chances of live birth on donor
I would say
cycles?
like it's like the opposite. I mean, so we are checking the embryos and we are transferring healthy embryos. The chance of implantation will be higher, and if we are also considering that an important number of potential miscarriages will be excluded. If we are checking the embryos, of course, the live birth rate will also increase.
Mhm. Yeah, thank you for the clarification. If you have any follow ups, go ahead, type those in. There are some questions left, a few of them. So if you wish to ask some more, you know what to do as always. Debbie would like to know, so what is the maximum age you would treat a woman using donor X? You've mentioned this, but I think it's
Mhm.
important to repeat that so everyone
Yeah, 50 years
remembers.
old.
It's 50 for sure, right? So this is the maximum age when it comes to Clinica Tambre and Spain in general, I think, right?
Mhm.
Perfect. Regarding the fish question, would you think it adds any? Oh, I think
I
we
think,
already,
yeah.
yeah, sorry, we already did answer that because there was a follow up on that. Okay, if you can have a look at this. So, surrogate adoption requires your experience and understanding. The family involved require privacy together with a Polish donor. Is this something you can help with?
I'm afraid surrogacy is forbidden in Spain, so we can't take part of that. I'm so sorry.
Of course, thank you for the clarification. So, as you know, not all the countries are allowing this kind of
Mm.
service when it comes to surrogacy. In Spain, it's not possible. Thank you for the clarification. And of course, let's see. Because the pregnancy rate increases with every transfer, is it then advisable to do a transfer immediately after a failed cycle or wait and do more investigations?
Well, it's true that it increases, but it doesn't mean that they have to take place immediately after first one. Um, I would say that, as usual, everything depends on the case. I mean, if it's the first embryo transfer with a good quality embryo that maybe was not tested before, and maybe the patients agrees with that, it would be just possible to move forward for the next embryo transfer. If the second also fails, in that way, maybe we should consider another option of doing additional tests, and see if there is like any other factor that can also be affecting. But as I mentioned, everything will depend on the case, and we always explain the different options to our patients, and then we decide if it could be a good option just moving forward for the next embryo transfer, or if, on the other hand, maybe doing some tests may help that patient.
Okay, thank you so much indeed. There are like 2 questions left, so we will be finishing shortly. However, if you have some more questions, this is your time to do so. Type those in. This will be like the final call for those questions. And let's have a look. Yvette would like to ask you what type of counseling is provided to patients concerning the potential future implications of egg donation, cultural stigma, how to tell the child the story of their conception, normalizing egg donation, and processing grief over not being able to use one's own eggs.
Yeah, actually, we have in Clinica Tambre specialized psychologist in terms of well, in problems of reproduction, and many patients have a consultation with them with also try to solve that issues. I mean, in the end, it's a very different procedure to understand and to start, and sometimes we need to accept some issues. So in that way, we always recommend our patients having, at least a talk with the psychologist that, yeah, for sure will help them in, in terms of knowing if it could be a good idea to tell the baby, or well, the kid, that, the kind of treatment the patients underwent in the past, or how to deal with that problems, or that question that they are so common from our patients. So in that way, I think would be a really good option to have that consultation or talk, to have, that counseling with the psychology, that for sure will be helpful for our patients.
Okay, thank you. Thank you so much for your question. And yeah, thanks from Yvette as well, as you can see.
You're welcome.
All right, the short question here, do you offer tandem cycles at Clinica Tambre?
I don't know exactly what it refers to. I mean, if
Yeah, I mean, if you can follow up, because I think that perhaps it's about egg donation plus own eggs. Sometimes I've heard something like that, but of course I'm not sure. So if you can
maybe
clarify,
like using at the same time the
yeah,
patient's eggs. We
maybe
don't
it's
do it
about that.
normally. What
Hmm.
the law says, at least in Spain, is that of course, if we have like maybe some eggs coming from the patient and some eggs coming from the egg donor, well, we can't do it like missing
Yeah.
the yeah, both kind of embryos.
Mhm.
So we don't normally do that kind of treatment. We just do first the treatment with the patient's egg. If XCD doesn't work, we start immediately with egg donation, but we don't mix both of them at
Exactly.
the same time.
Mhm. Thank you. If you meant something else, of course, go ahead, type this in. Okay. Thank you so much for your question. And here's the next one. So, what is the estimated cost for egg donation program using partner sperm?
Well,
Anything
for
you can
those
help with?
issues, as I'm not, I'm a doctor, so I'm not very, used to talk about money. So I guess that, ACOS can maybe get in contact with us, and I'm sure that my colleagues from the commercial department will help him quite much better than me, for sure.
Definitely, of course, that's understandable. So if you wish to ask about costs, you have to get in touch with Clinica Tambre team, and I'm sure they will be happy to give you some more details on that. And let's see, this is an interesting question from Rachel. Rachel, does Phenomatch take into account age difference between donor and patient?
Actually, not. It's just a technology to consider the biometry of the face, right? So it's not considering any other issues such as age or so, and also like age, eye color, hair color, and so. So that's the reason why we first select the donor, and then after having selected a certain number of donors, we do the phenomatch with the idea of trying to find the best donor for each patient, but it's just doing like a facial biometry.
Okay. Makes sense again. Thank you so much. Two questions left. Next one is, so if I have only one embryo of mine and you say usually second or third one sticks, should I do a donor embryo first? And if it does not work, use mine. I have only one of mine, so don't want to lose it. Any advice here?
I mean, so we are talking about the same potential rate of embryos. So, of course, generally speaking, but an embryo that comes from an egg donation treatment will have much higher rate of implantation than a donor than an embryo coming from a patient. So, we are talking about same rate embryo. So if the rate of that, the potential rate with the patient's embryo is lower than the egg donor's one, we can transfer it in the first or the second one. It doesn't mean that the implantation rate will be like start increasing, because we are just talking about same rate embryos. If we are talking about an embryo that has potential reduced implantation rate, we can transfer the first one or the second one, because it's not going to make a real difference.
Thank you so much. Definitely an interesting approach, but of course, it's never easy. It's never black and white. I think, unfortunately, so it's more complicated. But thank you so much for your question here. Next one, possibly our final question as well for today. So, how does donor selection work? Is there a waiting list, or are there registered donors who are contacted when a match comes up?
Yeah, actually, we have like a certain number of donors that have done all the tests, and they are normally taking the birth control pills. So when they are needed to donate, we just get in contact with them, and they tell us, in Spain is something completely voluntary. If they want to donate that month, they will stop the birth control pill and we start the stimulation. So in the end, just to give like certain information to our audience, when a patient or when a donor wants to donate, it takes, like, roughly speaking, 2 months to have all the tests ready. And after having the test ready, and if they are all fine, they start donating, not before. So that's the reason why we need to have like a certain good number of potential donors, to be willing to donate when they are needed.
Okay, thank you so much for yet another clarification. And in the meantime, we did receive one more question, and there's a thank you for your explanation from
Welcome.
Madeline. And what is the maximum number of times that one donor can donate per the Spanish legislation?
Well, the Spanish legislation doesn't say how many times the donor
Mhm.
may donate. What this says is that the maximum number of pregnancies from each donor and from each country is 6. So if the donor has donated, let's say, 4 times, and we have 6 pregnancies, that donor won't be able to donate at least for Spanish patients. So it can donate, and it can be used for foreign patients, but not for Spanish ones. But
Mhm.
actually, the
Yes.
law doesn't say that it has to be like a certain number. What we normally do is a maximum of 6 cycles. Of course, not all donors will undergo the all 6 stimulation cycles. Some of them do, but many of them say, okay, I'm going to donate maybe 3 times, and then I'm not going to donate anymore. So it depends on them.
Of course, definitely. Thanks from Rachel, right here for you as well.
You're welcome.
Brilliant. Thank you so much. I think that we've answered all the questions at this point. But of course, as you know, if you wish to get some more details, some more information, you can get in touch with Clinica Tambre. And I'm sure they will be able to help you out with some other questions and, of course, with some other details. But I think that is it for today. Thank you, everyone, for joining us. Thank you, Dr. Marban. As always, it's been very informative, very interesting session for sure. And well, I will put this comment here. This was a
Thank
such a
you.
lovely
Thank you
presentation.
so much.
Delicate subject, definitely not an easy subject. So thank you so much for bringing this up, and thank you for giving us all the answers here tonight as well. Anything else you wish to add before we actually finish for today?
Well, I hope that it has been interesting for our audience. And as we mentioned before, I hope that we have been able to answer all the questions
Definitely.
they have. And of course, it's also possible to get in contact with us as usual. And we will be glad to answer, the questions that they could be, appearing at that moment.
Brilliant. Thank you so much indeed
You're
again.
most welcome.
And as you know, we will be back with some more events coming up. So join us next week. We will be back on Tuesday. So I hope you will be able to ask some more questions, another topic, different doctors. As you know, we are back with some more educational events for sure. So thank you everyone for joining. I hope you will have a nice evening. Dr. Marban, as always, it's been great to have you indeed. And I'm sorry, this is not the slide I wanted to put. So thank you so much, everyone. And of course, I would like to say that European Fertility Society, we are really happy that we were able to provide you with some more events like this. And seeing you all here means that we can keep on going. There are more and more questions that we can help with. And of course, we have the best experts in the field to help you with those questions, as Dr. Marban today. So thank you. Enjoy your evening, Dr. Marban. See you very soon, hopefully, of course, as well.
Yeah,
And yeah, have a lovely evening. Take care.
likewise. Speak soon.
Bye.